It's time for your doctor's appointment on television. It's time for We, the Doctors. My name is Dr. Julz. Today we're talking about a topic that is increasing globally. We're talking about kidney stones, okay? What we do best is help you understand medical conditions so that you make better healthcare choices. And of course, I have with me the medical team. We have Dr. Waleria.
Hi, welcome to today's episode.
Dr. Yvonne.
Yeah, you're welcome.
Ever beautiful. And Dr. Okey.
Welcome to today's show.
There you go. So, guys, we're talking about kidney stones today, and the data that I got on the internet showed that it's increasing globally. Yes. Now, we all know, we know, but let's let our viewers know that it's commoner in blacks, okay? It's also it's found more in men, okay? And it's found in people in their 5th to 7th decade.
Exactly.
But we know we do find people much younger here, although we couldn't get the statistics for our environment. But it's important that we understand what it is. Another thing I would like to mention also is that it is not you swallowing pebbles or stones, like some people might.
So when children are playing and they swallow sand,
that's not what we are talking about. What happens is that the urine becomes very concentrated, and then the crystals are formed from minerals, and that's what forms the stones. So it can stay from, it can be located in the kidneys, in the ureter, all the way down to the bladder, and usually people pass it out, but if you don't, that's when it becomes a problem. Yes. So to start off the banter, we're going to talk about the risk factors first of all. So who's going to go first?
Let me talk about dehydration first.
Good.
Because you mentioned something, it's a sequel anyway. Yes. Dehydration, you know, people don't drink a lot of water. I don't know why, but people really do not drink the normal amount of water they're supposed to drink in a day. And taking our environment, for example, this place is very hot.
Humid.
We sweat a lot, so you need to replenish this lost fluid. Like you said, the urine becomes very concentrated. And so when it's concentrated, it gives time for the stones to be able to form under such environment. And again, people take too many fizzy drinks.
Absolutely.
These things do encourage the formation of kidney stones.
Even excess sugar in this, the way and all of that. But, sadly, in our environment, a lot of people rather the fizzy drinks to water.
Yes.
They tend to feel more comfortable, and all of that. And then you go for parties, that's where people expect that they drink all forms of fizzy drinks and all of that because they're not paying for it. You want to kill yourself. And then when you encourage people to drink water on those occasions, they're like, I can always drink water when I get home. I won't drink this one,
Yes.
Maybe it's not just the fizzy drinks or that I'm not paying for it. I want to hear that But seriously now, when you talk about kidney stones, something comes to mind. Most people that you find with kidney stones already have an underlying medical problem.
Absolutely.
It could be diabetes, it could be anything, but I like to focus on
gout.
Physical problems. Now you find out that the kidney, 1 or 2 pipes in the kidney may not have been well formed. Imagine a drainage system, normal gutters as we have them, and then you have blocks in the gutter.
Right.
What happens? You find debris begins to form more. Because the gutter is not flowing well, because there's a malformation in the gutter. It's similar in the kidneys or in the pipes around the kidney, ureter, uretras, call all the names you have to call. When they are not well formed, when there's a kink, it's also easier to form a stone around the area.
Exactly. You've been talking about hydration, taking lots of water. I would like to also point out that at least 2 liters of water a day. Nowadays, they're talking about 4 liters.
I tell people at least 3.
I even go for 4.
Imagine what happens when you're under the scorching sun.
Yes.
40 degrees, 37,
even
38.
if you don't see yourself sweating, you are still losing fluids.
You know, I had trouble when they mention insensible water loss. I'm like, can water ever be insensible? But really,
you need to
all right, talking about water, I mean, in some environments, what you tend to find out is that they usually, here we tend to chlorine our water, basically, and then they use fluoride most times, basically. So using fluoride is another risk factor for having kidney stones.
Exactly.
And then I think that's also related to people, some, toothpaste in an environment that's got a bit of fluoride in it and all that. So it's one of the risk factors
children,
as well.
And
Exactly. They swallow the paste and all of that. So it can be a risk factor for kidney stones. The diet is also really, really important. I know that spinach has a bit of oxalate in it.
Not just spinach. Some research found out that some research found out the economies that take more of animal protein. I'm not trying to spoil market for the suya people. If you take more of animal protein, statistics have shown that you have a higher chance of developing.
But then again, this thing can also be hereditary anyways.
Yeah,
there's also a bit of genetic influence.
Truth be told, it's also healthier to not do animal protein and all that. You want to do the salmon, the fish, and all that.
These things are not easy.
Some
of us don't even do all those things. We just love the animal protein.
Back in the days, we used to say that God made grass for food, talking about plants for food.
Well,
I'm sure you also made animals for food.
But no food is bad. It's how much you consume, basically. So we are not saying don't eat those things. It's how much you consume. And I also would like to mention at this point that calcium is one of the major culprits for the stones, okay? And people that take supplements, maybe like calcium supplements, because maybe for healthier bones and all that.
All those older women that are having osteoporosis and the rest of
you might be at risk. So you don't want to abuse your
generally vitamin D supplements, absolutely.
Exactly, because that also aids in the absorption of the calcium. Absolutely. Okay, so we are going to take a short break. When we come back, Dr. Yvonne will be leading us on the symptoms. You want to understand whatever you're going to experience if you have kidney stones. We are going to take a short break now. With the doctors continues shortly.
Coming up next.
There are minerals present in the urine. So these minerals tend to come together, they stick together, or what I call a process called crystallization. So this is what leads to the formation of the stone. Sometimes someone can have stones and be asymptomatic, that have no symptoms at all, and even pass these stones out in the urine, even unknowingly. Hello, you're welcome back. It's with the doctors. I'm Dr. Yvonne. We'll be talking about kidney stones, also known as nephrolithiasis. Anyways, kidney stones, like Dr. Julz explained earlier, forms when the urine is concentrated, being that there are minerals present in the urine. So these minerals tend to come together, they stick together, or what I call a process called crystallization. So this is what leads to the formation of the stone. Sometimes someone can have stones and be asymptomatic, that have no symptoms at all, and even pass these stones out in the urine, even unknowingly. And so at some other times, depending on the size of the stone and where it is located, like she said earlier, if it's in the urethra or it's all the way down, even to the outlet, it can cause particular symptoms. But the first one I'll be talking about now is flank pain, which is lower back pain. That's very, very, very common in people that have kidney stones. It's a very excruciating pain, and sometimes it even moves all the way from there to the groin area, that's the genitals, and the inner thighs. So we're
talking about this flank pain. I think they need to understand why they're having flank pains and you know, the back pains. You need to understand that the position of the kidney.
The flanks.
The flanks. So you're talking about the back. This is lower back here. And that's because the kidney is positioned around here. Exactly. And you also have the tubes, like the urethra is going down here.
There you
go. Going into the urethra. You're going into the bladder, and then you have the urethra. So that's why we're talking about the groin pain and the flank pain coming from behind.
But you know, before you go into specifics, things that you find, I think I want to mention a generalized symptom that is common. You have this urge to vomit, which we call nausea. And then you have vomiting itself. Now, I think it's important I mention it so that it's not every time you have nausea and vomiting, you begin to think of malaria. If you find any of the things we are still going to discuss in association with nausea and vomiting, I think it's time to run to the hospital.
Exactly.
Don't tell me you have kidney stones.
You leave it for the professionals to decipher what exactly it is. Now, talking about pain also, we also have pain with urination. You know, the stones, you can imagine, like Dr. Okey said, the pipes are there, and then there's something obstructing it. Definitely, if you are trying to urinate and something is obstructing the flow.
It can be very frustrating.
It can be very, very
You can imagine going to the bathroom and you want to pee and you're like, this urine is not coming out.
Dr. Julz, you know, sometimes...
So it's every time when you have that you think you got that thing.
No, but sometimes in patients...
Especially as the man, they don't tell you that you got gonorrhea. You just make kidney stones when you're trying to urinate and you're finding out to urinate.
Questionable actions.
You know, when you think a patient has kidney stones, there are times when I'm excited when they tell me about the pain. When I have this pain moving down, they describe it as a sharp burning pain. Moving down.
He's excited in a good way.
Because I feel the pain is going. I feel the stone is moving away from the kidneys, passing out the stone. So when that pain is burning from the flanks down to the lower parts, I know, okay, this guy is just passing out the stone. That's why he's creating that burning pain down. So it's not every time you say I have pain that the doctor is really worried you have pain. Sometimes I get happy. Yeah, when you tell me you have that pain and you describe it that way.
And then sometimes you might even have blood in urine. Sometimes patients can complain to you. There's an obstruction, and so because of that, sometimes they just even tell you that they notice one red thing in their urine, or their urine looks pinkish, and all of that. It's what we call hematuria. Yeah, and even but I mean, knowing all of the symptoms doesn't necessarily mean that you got kidney stones. Yeah, you know, one thing that may be familiar to this. So what you're just saying is that if you have some of the symptoms, you can, go to the hospital and probably get your doctor to examine you, and then he will be in the better position to tell you what exactly is wrong with you.
Wrong with you. I'm not telling you this information for you to play doctor. Exactly.
And also there's foul-smelling urine. When you notice your urine has a particular kind of odor that normally shouldn't have anyway, and sometimes it's discolored, it looks cloudy. So there may be an ongoing infection at the time. That's also associated with what Dr. Okey talked about before: nausea, vomiting, fever, and chills. The rest of them. So you might just want to see your doctor.
When you talk about foul-smelling urine, I like simple examples. Now, in your sink at home.
Even gutter.
Yeah, no, but let's use sink. In your sink at home, you have water pouring, and the hole is open. Water keeps flowing out. The moment you cover that water, I don't want to know how clean the water coming from the tap is.
Yes.
At some point, it's going to become foul-smelling. That's basically what happens. You have stagnation, you have the stone stopping it, and basically.
Makes a lot of sense.
So that's all we're going to take in this segment. So we want to ask, why do people have kidney stones? We're asking the question. I'm sure you have answers for us, but let's take a look at the streets, and we'll be right back.
Well, their diet is very important. Then they have to drink a lot of water. By the way, maybe they are chopping anything that comes their way through eating or through drinking, or the environment is not okay, or they are using anything apparatus to heat. Anything they lay their hand, they take it to heat.
A disease. I really don't know I don't know much about it.
I don't know. Kidney stones. Sorry, I don't know. I don't know. Probably because of what they eat. I don't know. But I've never witnessed someone that have it, but I do hear it. But to me, it's probably because of what they're taking, as a result of what they're taking.
Kidney stones. I don't know what you're talking about.
I don't know.
I don't know much about it. I'm not. I do hear of kidney stone. I don't know much about kidney stone.
It's true. Even me, I didn't know. I said you can put us through.
Well, basically, I'm not a medical student, but I also know it's a medical challenge, and I think it occurs as a result of not eating good food. Or if I'm right, I don't know if I'm right or wrong. That's all I know.
Why do people have kidney stones? Yeah, it depends on the kind of things you eat. I think it's caused by impurities in the body. Yeah.
Hello and welcome to today's episode of With the Doctor. It's time for our interview segment. And today we're talking about kidney stones. Now it's time for us to interview a specialist. We have a kidney specialist with us here from Kidney Solutions, Ikeja, Lagos, none other than Dr. Okey. Thank you for joining us today.
Thank you, Dr. Julz.
Okay, so basically you're here to explain to us how kidney stones are formed so that they understand what the whole science is all about, without going too technical. So
Sure.
Go for it.
So kidney stones are really made up of different minerals like calcium and salts, and the water in the urine dissolves them. But when, just like cement, if it gets too concentrated, the particles come together and start forming what we call stones. And the stones could form anywhere from the kidney to the bladder.
Exactly.
All right? And when they form, Sometimes you might not even know you have stones, or it might be really painful, or it might increase your risk for urinary kidney infections or bladder infections.
Exactly. So now the body is forming the stones. How is it diagnosed?
Well, like I said, many people can go through life without even knowing they have stones. When they feel that they may have a stone is when they either have a urinary tract infection or the stone is moving. It causes a lot of pain. All right? So when that happens, you usually might not even know that it's a stone, but when you go to the doctor, they'll ask you questions, they'll examine you, and usually with even things as simple as a plain x-ray, you can see a stone, and there are treatments that are available for that.
Okay, is there room for ultrasound?
Sure. Ultrasound is one of the simplest and safest things to diagnose kidney stones. A plain x-ray too is also there. Sometimes CT scans, but ultrasound and x-rays are simple enough to diagnose them.
Okay, so what are the treatment options that we have for kidney stones?
So there are two forms of treatment: medical treatment and surgical treatment. The surgical treatment really is for patients that have very big stones that cannot be treated medically and have to be removed surgically, especially if they're causing complications like a lot of bleeding or a lot of pain or repeated infections.
Okay, by bleeding, because it's in their urine.
Yes, and it causes a lot of pain and bleeding that's passed out in the urine. The medical treatment, though, very often is just more of advice and lifestyle modification. For some people, it's more than just lifestyle modification because it's because of some other medical problem they have. All right, but things like taking enough water, making sure you don't get dehydrated, at least 3 liters of water a day. Reducing your salt intake, because the more salt you take, it has to be lost in the urine, and the more concentrated it is in the urine, the more likely you are to form a stone. And then actually reducing the amount of animal protein in your diet is actually quite important. Yeah, I know we like a lot of meat, you know, and in our environment, especially where it's very hot, people can get dehydrated with a lot of meat. That makes the urine very acid, and acid actually encourages the formation of stones. So drinking a lot of water, low salt intake, low animal protein, you know, you can take plant or fish protein. That's a good alternative. And those are the key things.
Okay. So what do you say to people that would say, oh, I don't need surgery, if I take lots of water, I'll be able to pass it out? Is that possible? Or
it doesn't happen overnight. Sometimes it may, you know, depending on the size of the stone, it may take months to years for you to shrink the stone down. And when that stone is passing out, it may be very painful. Yeah.
So the final decision is based on the specialist.
Yes.
To tell you if you need surgery or not.
Yeah.
Exactly. Yeah. Thank you very much for your time with us on today's segment. So we'll be going back to the studio to complete today's edition. Don't go far.
Hello and you're welcome back to We the Doctors. If you're just joining us, we have been talking about kidney stones, and it's been an interesting episode, you know, an interactive session, hearing about what people think about kidney stones and what our guests, you know, thinks about kidney stones. But in this segment, we're going to be telling you ways about preventing kidney stones. And then if you've been listening very well, one of the major things we've been talking about, you know, is the fact that dehydration is a major cause of kidney stones. Talking about dehydration because a lot of people do not drink adequate water in our environment. People tend to take fizzy drinks as opposed to drinking water, which is of benefit. And we're saying that some people said you should take 2 liters per day, some said 3 liters, some said 4 liters. You know what? You can even get a 25 liters gallon. If you don't want, but my whole point is that you make sure that you drink a lot of water every day. Always go around with a bottle of water around you. Yes. Put it in your flask instead of carrying your juice and things, all right? Dr. Yvonne, what other things you think we should do?
You said the most important thing about talking about fluid intake. Yeah. So you want to limit taking all these soft drinks and the rest of them. Not that you don't take them, because they contain phosphoric acid, like I spoke about before. These things encourage the formation of kidney stones. So you want to drink water, not during, be an occasional drinker, if I may say. Don't make it a habit that morning, noon, and night you're taking fizzy drinks, because that's what some people do, actually.
Honestly.
As much as possible, I would say you should prevent recurrent urinary tract infections. Because some of these conditions can predispose you to kidney failures, to kidney stones. Yeah, so you have to prevent recurrent urinary tract infection. What's the simplest way of preventing this? He has already explained it, lots of water, but take the advice your doctor gives you. Some studies will ask you to take lots of citrus fruits, oranges, because they acidify the urine,
orange
they
juices.
reduce your chances of getting the infection. And when these chances are reduced, the chances of developing a kidney stone is lower. So if you can prevent recurrent urinary tract infections, it's going to help you.
The cranberry.
Yeah. Cranberry too is a very good one.
It's a good one.
Frankly, how often do we find it in our environment? If it's not that common, I would say
it's not even. You can find it in the environment. The problem is affordability.
Yes, exactly.
Then take oranges if you can afford them.
And also drugs. People take a lot of calcium supplements or don't even take anything that contains calcium at all. Either you overdo it or you do not do it to cause a problem. So you want to stay at a normal level.
Exactly. Kidney stones too can reoccur. And it can be a problem. So when all else fails, you just want to have it removed peacefully, which is, of course, that is the final result, of course, not...
but that's left for the doctor to decide anyways. And there's a little procedure it's called lithotripsy they probably could do for you to get off the kidney stones. Dr. Okey, what questions do we have from social media platform?
I chose a question that came in from Emeka. Emeka wants to know that when is surgery required? It's just what we discussed. Your doctor is going to help you decide
make that decision.
Frankly, surgery is rarely required. Let's hit the nail as it is, because if you take lots of water, chances are that the stone will pass out. Then if you are not having lots of water, you already mentioned lithotripsy. Basically, what happens in this is you have a stone that is large. The procedure is to break down the stone. Sometimes it's laser guided, sometimes ultrasound guided. They break down the stone, and the stone passes out. Thirdly, you can have a procedure, it's a surgery, but it's a tiny surgery where through your skin, you could even be awake while it's being done, mildly sedated. They pass a tiny microscopic tube. Microscopic meaning that even me doing the procedure has to wear microscopic eyes to pick out this stone. That's as opposed to open surgery, which is what you commonly find in our environment. But when all fails, it's important to follow your doctor's advice if a surgery is needed.
But I like the part where you talked about drinking a lot of water, because drinking water is it can make you pass out the stone, you know, without even having a surgery done. But that doesn't necessarily mean that you not start arguing with your doctor. I heard it on the doctor's show that if I drink a lot of water, the stone will come out. I don't want to do surgery. Let your doctor be the one to decide. Thank you very much.
It's very important. That, because I also keyed into what he was saying, because you don't want to send out that message that you don't need the surgery. If the professional is saying that you need to have it removed,
then you have to.
You have to listen to
making
what
that
says,
information with your best interest at heart.
Absolutely.
He's the one saying you. So
exactly.
He knows the best advice for you at the time.
There you go. So that has been our show for today. If you have questions, of course, the website to go to is cooltv.cool. You want to follow us on Twitter and Instagram. It's at We The Doctors. So you can send your message there or question, and we'll answer it here on the show. So from myself, Dr. Julz, and my colleague, we have Dr. Waleria, Dr. Yvonne, and Dr. Okey. We are saying bye-bye and stay healthy.